The 4th annual UCSF Digital Health Awards seeks to find the most impactful and disruptive digital health companies. Out of the 1,000 plus submissions, only a select few have become quarter-finalists.
Hi everyone, my name is David Maman and I'm the co-founder and CEO of Bina AI. At Bina AI, we developed a technology that allows us to use any smart device with a camera, a smartphone, a tablet, a laptop, and using the camera only, we're able to extract health data and multiple types of vital signs. Today, we're able to extract heart rate, respiration rate, oxygen saturation, blood pressure, and multiple types of heart rate variability parameters, as well as your stress level, and everything can be extracted just by using the camera itself. The go-to-market from Bina is that we are an enabler. We're able to enable any kind of a wellness program, a wellness application, or a wellness process to be able to extract health data without the dependencies of a specific hardware device. So we're not limited in the way that how customers can actually create multiple types of user journeys, create multiple types of plans, and actually ongoing processes to assess the wellness level of an individual, to build a plan and to actually monitor the improvement of this plan, and to also be able to actually maintain and assess on an ongoing basis whether a person might be actually getting better or not. Bina's technology is available to work on any iPhone, Android, Windows, and also web applications, so you're not limited in the way of how you can utilize Bina's technology. When it comes to superpowers, we are doing to medical devices and wearable devices exactly like what the smartphone have done to MP3 players. About 10 years ago, I would have probably bragged about my new MP3 player, but when was the last time that someone bought an MP3 player? That's exactly what we're doing to this industry. Thank you very much for having us.
Cricket Health partners with providers to provide services to patients with chronic kidney disease and facilitate proactive detection.
Cricket Health works with nephrologists and their patients to be the eyes and ears for them when their patients are outside of the office. It's an opportunity for nephrologists to do what they've always wanted to do, which is to prevent patients from progressing to end-stage renal disease.
What we are doing at Cricket is so revolutionary in changing the way that kidney care is delivered to patients.
Cricket Health is more preventive. That is the main focus here. We want to prepare these patients to live their best life and to make the decisions and empower them with education.
In other roles, it's more or less on a reactive side. Care for the patient once they've crashed into the emergency room or need dialysis, but this is different. We try to prevent patients from having to go on dialysis at all if we can.
Hi, I'm Bobby Sapuka, CEO of Cricket Health. We provide personalized, evidence-based care to people with kidney disease so they can live their best lives. Our superpower is understanding that the key to changing patient behavior is fundamentally changing the way in which we engage patients. That singular insight powers everything we do. It's the guiding principle behind our machine learning predictive model that we call StageSmart that lets us identify with 96% accuracy who are high-risk patients, even if they have yet to be diagnosed. It also informs our care model, where dedicated longitudinal care teams can create and foster deep relationships of trust with patients. So every patient gets their own nurse, dietitian, social worker, pharmacist, and patient peer mentor. By forming long-lasting relationships with their care team, patients feel comfortable sharing more, and ultimately, they're able to learn more. And it's why we are unapologetically virtual first, creating a platform in which patients can not only immerse themselves in information about their disease, but also interact with their care teams asynchronously and synchronously over talk, text, and video. We're turning the industry standard on its head, no longer asking patients to engage with their care teams or clinicians when it's convenient for the clinician. At Cricut, we make the interaction happen when it's convenient for the patient. The result is a high-touch, deeply interactive model that delivers personalized care to patients who need it most. We think we should win because we're changing what a kidney diagnosis means for the 37 million Americans who manage the condition today. Instead of waiting for their kidneys to fail and start dialysis, which has been the standard of care in this country for 50 years, we're helping kidney patients before and after kidney failure live their best lives. And we're doing it while lowering costs for payers. Better outcomes for patients and lower costs for the system. That sounds like a winning combination to me. Thank you very much.
Six in 10 adults in the U.S. have a chronic condition. 4 in 10 have 2 or more. And 1 in 4 of our healthcare dollars go to just caring for people with diabetes. While others work in silos or offer siloed solutions, we have an integrated platform that helps not only individuals, but also care teams and health ecosystems to make better clinical decisions. It works by connecting them all across the care continuum. Sure, the WellDoc platform starts with an app, offering real-time AI-driven coaching for people with chronic conditions. But it's also connected to a portal for care team and connected to a comprehensive reporting dashboard for organizations to help optimize care across populations. And it seamlessly integrates into existing care models, workflows, and systems, which aligns with our other key differentiator. We partner across the healthcare ecosystem with payers, health systems, and employers to optimize and extend chronic care programs. We also partner with industry leaders in life sciences and medical devices to build first-in-class solutions to solve for complexities associated with chronic conditions. We're further differentiated by our commitment to clinical rigor, our ability to address multiple conditions and comorbidities in one consistent user experience, an industry-leading AI that connects 6 dimensions of health, and of course, the real results we consistently deliver, demonstrating our impact to key vitals like A1C and blood pressure, while also increasing patient engagement, lowering costs, and so much more. And we're being recognized for it by industry thought leaders. Thank you. We are so excited by this opportunity with UCSF and sharing WellDoc's passion for transforming chronic care around the globe.
Taking the first step is never easy, yet here you are, on the journey to improve your health. Congrats on getting here. Now, let's see how Clinio can help you progress even further. Together, we will change the way you look at your nutrition, physical activity, health monitoring, and new habit formation. Clinio creates a daily plan that is easy to complete and always brings you closer to your health goal. After the first month of using the app, Lisa can already see her weight loss progress. She also measures her blood sugar every day and can clearly observe that Clinio program actually helps keep the blood glucose level in check. The start is simple and the end goal is inspiring. Now it's time to begin improving your health. Clinio will guide you in your journey and will always be there to advise you. Let's manage diabetes through the power of habit.
Clinio is an app created for people with diabetes and pre-diabetes. It is carefully designed by a team of nutritionists, doctors, and diabetes educators. The app covers the main aspects of diabetes management, like nutrition, workouts, health data tracking, medication logging, and education. It helps users to achieve healthy, long-term weight loss, stable blood sugar results, and other important health goals. No other app or any solution in the market is as focused on improving the lives of people with diabetes or pre-diabetes. Clinio is in fact an all-in-one tool people can turn to when trying to manage their condition. The app offers a unique meal plan for each user based on their needs, which allows them to set their calorie intake, plan meals in advance, and learn what affects their blood sugar and cholesterol levels. The integrated home workouts help users achieve their weight loss goals and improve their physical form. And finally, the detailed health data tracker provides users with an overview of their progress. Here at Clinio, we already have more than 180,000 customers worldwide who love and use our products to better manage their diabetes as part of their daily lives. And we are also an international team of product developers, nutritionists, and clinical experts who bring best practice, innovation, and clinical expertise from some of the best public and private health systems from all over the world. And we package it into one single app.
Hi! Kiddo is a smart band for kids, like me. It gives parents insights about our health so that we grow up to be big and strong. My parents tell me they love Kiddo because it keeps me active and healthy. I can't wait to show you all the key features that my parents use that you can use too. This is the dashboard where my parents can monitor my wellness. It shows daily and weekly information on my heart rate, temperature, overall stress through social emotional score, and activity levels, as well as steps and sleep.
Kiddo is a connected care platform for pediatrics with integrated remote patient monitoring, clinical decision support, and patient engagement. Through proactive care of children with chronic conditions such as autism, asthma, and congenital heart disease, Kiddo reduces the overall cost of healthcare delivery while improving the level of care delivered. Kiddo is a unique health management system designed exclusively for kids. Today, it is the only pediatric RPM platform with the ability to work with the entire healthcare ecosystem. All of us want our children to live better, healthier, and to receive the best care exactly when they need it. Kiddo delivers that. We are changing lives and are honored to be considered for the UCSF Health Award.
Welcome to our Dakadoo demo. Once the member downloads the Dakadoo app, they're able to create an account independently or through an access code or a QR code to access the app. They are required to enter their name, date of birth, height, weight, and gender or sex at birth as a first step towards their health score calculation. The user now has access to the app's main page, where they will be prompted to complete a short assessment to show the user's first health score. The more information they provide, the more precise the calculation will be. The Dakadoo Health Score represents the overall health and well-being of a person in a single number from 0 to 1,000, and it is based on more than 300 million person-years of scientific data. The higher the score is, the better. Our award-winning health score technology considers all aspects of overall health: nutrition, sleep, activity, self-control, mindfulness, physical health, and mental well-being. The user can now dig deeper into their health score and how it changes over time depending on their lifestyle choices.
Hi everyone, my name's Julia and I am the CEO and co-founder of Lark Health. We're the leading AI digital chronic condition management and prevention platform. We're proud to be a covered benefit for more than 30 million people now in the US who are managing and preventing chronic conditions, stress, and anxiety. I started Lark because of my own personal experiences. I've lived with chronic conditions all my life, and it showed me how important 24/7 compassionate care is for managing a really complex condition. Our cutting-edge conversational AI, paired with remote patient monitoring, provides around-the-clock, 24/7 unlimited care for those who need it, anytime, anywhere. Our company's superpower is probably our tech. We spent 9 years in tech R&D We invested about $100 million in investment. And that's when we started to achieve clinical equivalent outcomes to live nurse-driven programs. With tech, though, you can really drive up the scale because there's not enough nurses and doctors in the world, and you can start driving down cost. I believe Lark should win the UCSF Digital Health Award because our industry-leading tech enables us to deliver virtually compassionate care at unprecedented scale and cost. And with 2 billion people struggling with chronic conditions around the world, we need much more scale and much lower cost to finally start curbing this worldwide epidemic. We're so proud of the difference we make in people's lives.
Prevent, a digital therapeutic that brings world-class behavioral medicine right to your fingertips. If you're eligible for one of our programs, the first step is to complete a profile, upload a photo or stay anonymous if you prefer, and then write a brief hello to your future group. The Prevent experience doesn't live in a vacuum, so we ask some thoughtful questions about the realities of your daily life. That includes current food and exercise habits, social tendencies, even feelings of mental well-being. This is great background information for your health coach, and it also helps us match you into a peer group according to a constellation of factors, including age, BMI, where you live, and even softer metrics like personality type or life stage. We also dig into readiness to change. If you're truly ready, we'll put the best science and support behind you, but the first step is still yours, and you must be ready to make it. You'll then receive a welcome package, which includes a wireless scale with embedded cellular chip that's already linked to your account. Zero setup or Wi-Fi required. Just open the box, step on it, and it instantly sends data to your private profile. The entire program is supported by the best behavioral science, the most engaging design and content, and an approach that integrates seamlessly into your everyday life, where habits are both made and made better. Welcome to Prevent.
So I founded Omada Health over 10 years ago with really a mission to show the world that it would be possible to create a reimbursable prevention program specific to the area of diabetes prevention. Fast forward to date, just under 1 in 10 commercially insured adults in the U.S. has Omada as a reimbursable benefit in their medical policy. We've supported over 600,000 and growing members in prevention, and we work with over 1,800 self-insured employers and dozens of health plans. I'm proud in that the way that we did this was starting with evidence, which I know will be important to UCSF. We now have 22 peer-reviewed publications, including the largest and only to our knowledge RCT of a diabetes prevention program specific to digital intervention compared to control. Through that, we've been able to create the world's first digital specific CPT code in partnership with the AMA, which has enabled us to catalyze our commercial traction with health plans and employers. Trust that we're not resting on our laurels. We're proud of what we've done, but we aim to continue pressing forward until we hit the millions of Americans in the spirit of someday bending the epidemiological curve in diabetes and other areas.
Join us on November 14th for our grand finale at Health in Las Vegas to see the winners crowned.